Because of the new order, overworked hospital teams will be doing even more. Many are not only already burned out by the workload, they're facing abuse from patients and families because of the misinformation about the virus and the vaccines. Our Alan Janae talked with a frontline nurse from UCHealth about the situation. He's live tonight with her story. Alan?
Well, Jim, if you remember the early days of the pandemic, we did not know a lot about how this virus was transmitted. But still, doctors and nurses at places like UCHealth here took care of the sick and dying. They try not to judge how people get ill, no matter if it's COVID or if it's cancer or whatever. But what they're getting back now with this disease has changed a lot. All these months, and she's still at it.
My world is still fully COVID.
At the beginning of the pandemic, when they asked for volunteers in the COVID ICU, Kathleen Combs raised a hand and donned layers of protective gear. That was 20 months ago. We first spoke with her a year ago.
It doesn't care who you are. It doesn't care what you believe.
How many people do you think you've seen die?
Hundreds. I shed tears at the hospital. I've shed tears at a patient's bedside as they take their last breath. I have visions of their faces in my head before they had a breathing tube, and now they're no longer on this earth.
But now, after all these months, there's a difference, including vaccines.
Did you think the pandemic would be over by now?
I was really hoping so.
Yeah. She remembers when they first came out, the thought that it would change everything.
There was a lot of excitement, and I felt this relief on my shoulders. I really did. I thought, wow, okay, we're going to turn the corner.
But that hasn't come. The patients and their families have changed.
It's hard when you know that you're doing good for the patients, but they're yelling at you, that we are causing this. They're telling us that it's the breathing tube that's going to kill them. No, it's the COVID that's going to kill you. There are those who just absolutely will deny it all the way until the moment they're no longer alive.
Are you taking guff from family?
Absolutely, yeah. We get threats. We have people yell at us on the phone. People, they're not nice.
The misinformation she's seen on social media and false claims are hard to see.
I can't stand it. It makes me angry, and I don't need to be any more angry than I am when I have to watch the suffering I see.
But she'll keep going to the COVID ward, she says, because it's what she does.
I'm one of many. I'm not the only one.
Not alone in a new reality of denial, while she still cares.
And I still wonder every day why I do this, but it's my job. I can't imagine doing anything different.
Combs says she is concerned about the future if we're going to get into the habit of not trusting the science behind vaccines. Particularly worrisome, she says, is the flu season ahead if people don't get a flu shot and case numbers with COVID keep rising. In Aurora, I'm Alan Janae, covering Colorado First.